Filler complications like this, or even this can happen to any of the patients in any setting. What are the solutions and how to avoid complications like that? This is Dr. Yasin from SKIN4U Med Spa in Commerce Township, Michigan. Today I'm talking about a product called Helenyx. The other name for it is Hyaluronidase. This is an enzyme that is made by different companies and it's used to dissolve fillers. Of course, any injector in any practice setting, they have to have it on board. Because no matter what your skills are or how experienced you are, there is always a risk of vascular complications. We're familiar with standard anatomy for any patients, but there are always variations, and the risk of vascular occlusion or filler migration is possible. So where and when you can use Helenyx? Helenyx can be used in the area of defect. For example, if you have a lip filler migration, you can use Helenyx. If you have a vascular occlusion or blanching in one area that you injected with filler, you can use Helenyx. I will advise that you perform a hypersensitivity test before you inject Helenyx. How do you do that? Is by injecting 3 units of Helenyx under the skin and monitor for swelling, rash, or redness. This will help you to determine that the patient is allergic to the product or not. If nothing happened, then you may proceed with the process. Keep in mind that this reaction may happen after 5 to 10 minutes. Any number I say today is not a reference. It's only for your knowledge, and if you want to know how much you want to use, please go to the reference guide for better assistance. Now, the literature say you have to inject 30 units of Helenyx per 0.1 ml of filler that you used. Those can range from 150 units per treatment to up to 300 units. In the literature, there are cases reported to use 1,500 units of Helenyx per treatment. How much do I use in the practice? Well, it depends on what I'm treating. So for example, I have this case I'm showing you now. This is lip filler migration, and I'm going to go over reasons of lip filler migration in a different video, but we only used 10 units to 15 units of Helenyx to treat the condition because the patient did not want to dissolve the filler completely. She had a lump that's lip filler migration, and we treated it on spot and everything was good after that. How do you administer Helenyx? First, you have to calculate the dose carefully, and then when you administer it, tell your patient that this will hurt, it will sting, and it will be painful. And you have to rub it really, really good so you distribute the medication evenly in the area that you inject. Don't forget, rub it really, very good and firmly. Okay, so if you have questions, please don't hesitate to contact me through email, website, or phone number. Like, share, subscribe for more videos. I'll see you in the next video. Thank you so much for watching.